Hi, Mr. Mayor. We reported on the Bronx having a higher rate of hospitalizations and deaths for coronavirus relative to its population than the rest of the city. Some of the elected officials we spoke to said there's no testing site in the South Bronx where a lot of these more serious cases are suspected to be, like a public or a big testing site there. That would allow people to know to self isolate and also to communicate to others, that they've tested positive. Why isn't there a large testing site in the South Bronx? And has the Department of Health taken a look at the Bronx statistics and come up with any explanation for the discrepancy?
So I'm going to start and then pass to Dr. Barbeau, who importantly grew up in the Bronx and is very attuned to the needs of people in the Bronx. I think we're in a moment where the testing dynamics are starting to change, but we're certainly not all the way there. I mean, Yoav, I think if we could replay this entire horrible history we've gone through, we would say what differentiates us from some of the places that actually were able to really get ahead of this is that there was not testing available when it was needed early on, when it could have been strategically crucial. And that's obviously at the feet of our federal government that, as we know now, had a lot of information about the danger of this crisis and the ability to mobilize and get the testing out, and they didn't do it. So that's where we could have had the strategic opportunity to potentially change the trajectory. Once it was already a full-blown crisis with community spread and all, we got very clear about the need to focus the testing on healthcare workers, first responders, and people with the most severe medical problems to help save their lives. We're starting to see signs of greater testing supply coming into play. But I don't think that changes the core reality that as there's more testing, we still have to first and foremost make sure that we're maximizing the impact on healthcare workers, first responders, and those in greatest need. And remember, the numbers are continually climbing in terms of cases, in terms of number of people in the ICU. So we can't act for a moment like any one piece of this equation is static. The crisis keeps growing. Even as we're getting more testing supply, we have to keep applying it to the highest priorities. If one day it was truly, truly abundant, I think we could have a different conversation. But I don't think it changes the guidance, and I suspect you're going to hear this from Dr. Barbeau. If someone's not feeling well, we want them to isolate and go home, and they don't need a test to follow through on that. And that's still the thing we have to get really, really across to people. Like, that's the most valuable thing, is responding to what their body is telling them.